24-year-old man who presents to the emergency department 6 hours after a motorbike accident. He has a mid-shaft tibial fracture. He received IV opioids for pain control. So, for example, maybe he received IV hydromorphone, or he received IV morphine or fentanyl, okay? But is now complaining of increasing pain in his right leg. On exam, the leg appears swollen and tense. Passive dorsiflexion of the foot elicits sharp pain. Distal pulses are present. What's the most appropriate next step? A. Elevate the leg above the heart level. B. Repeat analgesia and observe for response. C. Perform Doppler ultrasound to assess arterial flow. D. Measure intracompartmental pressure. And E. Send the patient for urgent MRI of the leg. What is the correct answer? The correct answer will be D, right? This patient has signs suspicious of acute compartment syndrome. So this patient has signs suspicious for acute compartment syndrome, where the patient is presenting with pain out of proportion, pain with passive stretch. And while it's a clinical diagnosis, measuring the intracompartmental pressure is the correct next step if there is diagnostic uncertainty. All right? So please remember that, especially if the exam is limited or symptoms are atypical. So you can look at certain signs and symptoms and tell that, oh, the patient is getting acute compartment syndrome. However, if you want to be dead sure, then you've got to measure the compartment pressure.